Yikes! It's that time of year again. You know what I'm talking about. It's that time when you go to the calendar and see Medicare renewal deadline on December 7th. You have received Medicare and You from the federal government. The television is barking out lots of ads about Medicare Advantage. This one is perfect for you. In your mailbox, you will find it filled daily with lots of ads from insurance companies saying, try this plan. It will do everything you need. You have dreams or nightmares about Medicare Part A, Part B, Part C, Part D, Medicare Advantage, Medigap. What does it all mean? How do you tell the difference between them? What does Medicare actually cover that you're going to need supplementary insurance to be able to fill in the gaps? Hi, I'm Sue from the Wellesley Free Library. You can always turn to your public library for the most reliable information to make decisions. We have a tool I'd like to tell you about today that will help you by giving you a custom report that will define all the information, tell you what Medicare does and doesn't cover, and give you some pricing on what you can expect to pay. Let's take a look at what we have to offer at the Wellesley Free Library. The tool I want to show you is the Weiss Ratings Medigap database. This is going to help you choose your Medigap plan wisely by giving you information that you will find helpful. Medicare eligibility has a 7-month initial enrollment period. This is 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. Once that's in place, every year there's an open enrollment period, which is October 15th through December 7th. What is there to Medicare coverage? There's Medicare Part A, which is a hospital insurance, Medicare Part B, which is a medical insurance, Medicare Part C, which is the Medicare Advantage that we talked about earlier, and Medicare Part D, the prescription drug plan. Medicare Part A is going to cover hospital-related services and emergency care, inpatient hospitalization, home health services, skilled nursing services, and hospice. For Part B, you're going to cover deductibles, copayments, and coinsurance, doctor office visits, lab services, ambulance, and diagnostic services. So you think you're covered? Just think again. Without Medigap, these are some of the out-of-pocket costs you may need to pay. Hospital deductible, annual deductible, medical supplies, first 3 pints of blood, hospitalization, days 91 to 150, skilled nursing facility care. Medicare Part D covers your prescription drugs. What are the hidden costs of Medicare? Well, we just named some of them: prescription drugs, vision, emergency care abroad, dental, and hearing aids. How do you fill this gap? There's Medicare Advantage, Part C that we talked about through private insurance companies. This will give you extra benefits. And then there's the Medicare supplemental insurance, the Medigap, which is what we're really concerned with today. Here are some differences between the plans. The Medigap Original Medicare plus the Medigap Supplement. You may have higher premiums but no copays, freedom to choose your doctors, no referrals necessary. Some routine services are not covered, the vision and hearing, and you're covered anywhere in the United States. Medicare Advantage plan, generally lower premiums but has copays, may be restricted to a network, and you may need referrals for specialists. They may include extra benefits, which is a plus, but emergency services are only outside of the service areas. There are some secrets to the Medigap plans. Did you know that Medigap plans offer identical coverage? Massachusetts has 2 Medigap plans, the Core Plan and the Supplemental 1 and 1A plan. Here you see a chart of the standardized Medigap policies that are available for you in Massachusetts. Massachusetts benefits, you can see inpatient hospital care, covers Medicare Part A coinsurance, plus coverage for 365 additional days after Medicare coverage ends. Medical costs covers the Medicare Part B coinsurance, generally 20% of the Medicare approved amount. Blood covers the first 3 pints of blood each year. Part A, hospice coinsurance or copayment. The check marks in this chart mean that the benefit is covered. Notice the foreign travel emergency, which a lot of people overlook. Supplement 1 plan will cover that. The core plan does not. So there is a difference between the two plans that you have to choose from. Secret 2, Medigap plans are standard, but the rates are not. Identical plans that companies are charging different premiums for. So you need to look closely to see what each company is going to charge. They can vary thousands of dollars every year. How safe is your insurer? You may not think about that all the time, but you want to make sure that that insurance company is going to be around when you're going to need them. So Weiss does some safety ratings on their financial stability. As you can see, A and B, excellent and good, you definitely want to go with that. C, you can still go with that. But D and E, avoid companies that have that rating. Secret 3, safer insurers are not necessarily more expensive. Someone who has an A rating may be cheaper than someone who has a C rating. Higher premiums don't mean you're getting coverage from a stronger, more financially stable insurance provider. Secret 4 is that you can make the choice. You don't have to let someone else do that for you. You need to balance the financial safety of your insurer with your choice of plan. You can get more coverage for less and many times reduce your premium. The Weiss database gives you a customized Medigap buyer's guide where you can learn what Medicare does and what it doesn't do. It's customized to your age, sex, and zip code. You can choose from all available insurance companies for your state, and you can save valuable time and money, as well as get a safety rating of every company that is provided in the report. Each of the plans is explained with current premium costs. How is the custom guide set up? Part 1 answers questions about Medicare for Part A, B, and D, and it's found in chart form. So you'll have the service in one column, the benefit that you are provided by Medicare, what Medicare pays, and then what you're responsible for. And this is very beneficial to everyone if you don't truly understand what Medicare is offering you and what they're paying. Part 2, which company should you choose? It rates the financial stability so that you aren't caught without insurance company after you have paid your premium. Part 3, Medigap premium rates for the core plan, Supplement 1, and Supplement 1A. In Part 4, you're going to get an index of all the insurers included in the guide with the contact information so that you can call them or make an appointment if they're local to be able to go in and talk to them to get clear answers to your questions. Finally, you can get helpful organization contact information who may provide you more information about Medicare. And you get all of this for free with your library card. You just click on the eLibrary tab at the top of the wealthyfreelibrary.org page and then click on Databases A to Z. These are some other resources on the internet that you might want to take a look at. Now let's just look at how we can get to the database on the wealthyfreelibrary.org page. As I mentioned, you click on eLibrary at the top of the page, Databases A to Z. You will get an alphabet that you can click on, and we're going to click on M for Medigap. Once we're there, we click on Medigap Report, Weiss Ratings. Here you will be able to put your first and last name, your email address, your age, your gender, and your zip code. Over here it explains exactly what to do, and it also tells you that if you're uncomfortable putting your name in for privacy reasons, they don't collect your information, but you can put your initials up here. You could actually put a different name on there or different initials and put an email. It's just looking for that @ that you see there, and they suggest you put ignore@grayhouse.com. And they need to have that because they try to send you by email a copy of this custom guide. You don't need to receive it by email. You'll have an opportunity to generate the report and print it out if you want to, or download it and save it to your computer, at which point you can email it to yourself if you would like, or to someone else if you're doing this for a relative, that they're in the state of Massachusetts or anywhere in the United States, because the guide will send you something for that particular state. Once you have all your information in, you click Get Report, and you will get back Weiss Ratings Medigap Report, customized just for you. It also sends the email at that time. You can view the report by clicking here, and this is what the report will look like. We hope that you find a lot of useful information in this guide. If you have any questions about how to be able to generate this guide, please just call us at the library and we'll be more than happy to help you.